Hello everyone, welcome to my channel. In this video I'm going to talk about colitis. What is colitis? The inflammation of the colon is called as colitis. Means inflammation of the large intestine is also called as colitis. Okay, and unhealthy growth in the colon lining. Sometimes tissue in the colon changes as a result of genetics, high fatty or low fiber diet, or exposure to cancer causing substances. As this tissue changes, growths like polyps or cancers may appear in the colon lining. What is polyps? The benign polyp is a non-cancerous growth. It can be as small as an pea or as large as an golf ball. The larger the polyp, the greater is its chance of turning into cancer. Early removal of benign polyp may prevent them from changing into cancer. What is cancer of the colon? A cancer is made up of abnormal cells that are growing out of control. Cancer are most often the size of an mushroom or larger. They can grow into the colon lining and spread to other parts of the body. Sooner cancer are removed, the greater the chance of preventing the cancer spread. What is cancer spread? If cancer cells break off, they may travel through the colon lining into the lymph and blood vessels. These vessels may carry the cancer cells to the lymph glands, liver, lungs, or other organs, starting new cancer. This cancer spread is called as metastasis. I'll be discussing about few homeopathic remedies in this video about colitis. Okay, the treatment of colitis and cancer treatment of colon. Myself, Dr. Megha from Homeopathic Clinic. I am a practitioner of homeopathy from 5 years. Allium sativa. Colitis with stools containing shed of intestinal mucous membrane. Great anger, especially indicated in high fevers and fleshy person. Halosacotina. Constant bearing down in the rectum, bleeding. Rectum feels sore and hot and is revealed by cold water. Lot of mucus and wind is expelled with stools, and the pain remains in the rectum after passing stools. Gurgling in the abdomen. Halosacotina is mainly given for the intestinal problems. Argentum nitricum. Membranous stools, flatus expelled with a noise, constipation, pain in the region of the spleen. Cantharis. Smell of food causes nausea. Smell of the food causes nausea and vomiting. Stool are membranous, colicky pain, and there is much more number of gas formation. You can think of cantharis. Of course, the cantharis is given for urinary organs, but it also gives in the inflammation of the colon. China, yellowish watery stools, absence of pain. Some gas is passed with the stools. That time you can think of China. China is mainly given for the GI tract, so you can think of colchicum antimony. Distension of abdomen with wind, pain in the region of liver. Stool contains white shades. Cholesynthesis. Severe cutting pain in abdomen, forcing the patient to bend double. Pain worst after hunger, bitter taste in the mouth. Then you can think of colocynth. Colocynth is also given for the pain remedies because there is severe cutting pain in the abdomen, forcing the patient to bend double. Then you can think of colocynth. Ficus indicus. Hemorrhage before passing the stool. Stools are bleeding with pure red blood and colic. Colitis. Chronic intestinal ulceration and perforation with cutting pain. Soreness and burning. Diarrhea or dysentery. Stool brown, jelly-like and frothy. Lacasis. Colitis with offensive diarrhea alternating with constipation. Abdomen very sensitive to pressure. Magnesium carb. Abdomen distended diarrhea. Stools are green and forced out. Mercurous core. Diarrhea or dysentery due to ulceration of the intestine with so much of pain and twitching of the muscles. Stools are very hot and containing blood and mucus pieces also for sometimes, not every time. Selenium met. Colitis on account of tuberculosis of the perineum. Sepia. Endo means the colitis is given in sepia, the leading symptom of chronic colitis, or it is a choice of this remedy. Always first after taking milk. The patient should present that always first after taking the milk, then you can go with sepia. Staphysagria, simple or ulcerative colitis after insults and injuries like after the rape kind of thing, any kind of thing, then you can think of staphysagria. Sulfur treatment should be started with and ended with this remedy. In the middle you can give any kind of constitutional remedies, but it should be started and ended with the sulfur. Tuja, colitis on account of anemic dysentery. Okay. In chronic ulcerative colitis, the intestine is very irritated and develops raw areas. It results from prolonged diarrhea or dysentery. Cancer can occur if the disease remains for many years. It is second only to lung cancer as an fatal cancer. It is preventable in 95% cases. There is a polyp or a tissue mass which forms the cancer. It can be detected by fecal occult blood test in a laboratory or by colonoscopy. When detected, the cancerous portion is removed surgically. Such surgery is called as colostomy. Surgery is still most commonly used for cancer of the colon and rectum. Colon has no essential functions in regard to nutrition. It merely converts the waste of the food to a solid stool. So the infected portion of the colon is removed and its further function is taken over by the remaining portion of the colon. Greater the portion of the colon removed, greater is the reduction of the solidity of the stool and it becomes more watery. Surgery of the rectum is complicated because its lower portion, means anus, contains the sphincter muscles which control the bowel actions. In such a surgery, the end of healthy remaining colon is connected through the wall of the abdomen to a plastic bag in which the stool is being discharged. What is colonoscopy? Colonoscopy is an advanced technique for viewing the whole colon. A screen or a high piece may be used. Colonoscope is a thin, lightened, flexible tube which is moved through the colon. It is used both to diagnose growths and to confirm findings of other tests. It can also be used to remove small polyps and to collect tissue samples for analysis. The patient is lightly given the painkillers or anesthesia during the, not anesthesia, some sleeping kind of pill for the reduction of the pain during the procedure. That's all. Colonoscopy provides an inside view of the entire colon. Colonoscopy can be used to locate and remove a small polyps also. It is also used for the removal of small polyps. Okay, this is all about the colitis, inflammatory colitis, or inflammation of the colon, or CA of the colon, anything you can. Of course, this is one of the second leading common factor in India, so better be cautious, and also remember about what kind of stool you are passing, what are the pains, how the pain is there. Don't neglect it and don't take it to the worst stage. If you are genetically connected, please go check it for